Omicron has reached a peak, but that hospitalizations tend to take a little bit longer to drop off.
KRON4's Rob Nesbitt reports on what nurses and doctors are currently dealing with in the ICUs.
Though Omicron isn't causing people to be as sick as the Delta variant did, hospitals are still under an immense amount of stress because of staffing shortages and because of how contagious Omicron is. It's been 2 weeks since medical staff at Queen of the Valley Hospital in Napa faced the worst of the COVID surge, patient numbers doubling overnight.
We went from 12 patients in the hospital to 22 with another 2 in the ICUs.
Chief Medical Officer Dr. Amy Harold says most patients weren't as sick as past surges, but more nurses and doctors have had to quarantine after testing positive for COVID.
It's been a long time of asking people, begging people to take overtime so that we have the staffing.
She says that cases seem to have leveled off this last week. Same thing at UCSF Medical Center, according to infectious disease expert Dr. Peter Chin Hong. There are currently 108 people hospitalized with COVID at UCSF, down from 138 on January 19th.
Before Omicron, we were seeing maybe less than 5, sometimes no cases per day in the hospital. So to go to 138 or 108 is actually a huge burden.
A national survey by the American Medical Association shows that a high percentage of nurses have the intention to quit healthcare because of COVID fatigue.
That's 40%, and then 20% of physicians also say that, which is really shocking.
Dr. Harold works to keep morale up at Queen of the Valley by highlighting positives during morning huddles while also being transparent about the current state of COVID.
And in healthcare, we can't forget we have to take care of ourselves and each other first to make sure there's enough people to take care of our patients.
Dr. Harold says a big problem in hospitals right now is the high number of people going to the ER to try to get tested for COVID. She says you should avoid the ER for that, and instead try to get a test by scheduling an appointment with your doctor or trying your local pharmacy. In San Francisco, I'm Rob Nesbitt, KRON4 News.
Coming up, flames